Okay, great. Okay.
Oh, sorry.
Sorry, I think we should be live now.
Okay.
I'm just going to give a quick introduction to the event in general, then I'll hand over to you and we'll post this event on the event itself. So welcome everyone. Today we have another event hosted by the Oxford PPE Society with Professor Jane Gingrich, who's a professor at Magdalen College Oxford of Comparative Political Economy. And in this event today, she will talk about a variety of issues, mostly in focus of inequality and the role of public policy in a post-COVID-19 economy, and just a whole load of issues surrounding the COVID-19 pandemic and how we might go about fixing or attempting to solve these issues. And without further ado, I would like to hand over to you, Jane, so you can start your presentation and I go about fixing the technical issues.
All right, great. Thank you, Mika, Eric. Sorry, I need to get this back up to the top. Is the slideshow, can you see it?
Yeah, that seems quite good.
Okay, hold on. I'm just going to go to full screen. All right, well, thank you so much for inviting me to the PPE Society. It's a pleasure to be here virtually. So Mika Eric asked when he initially approached me to think a little bit about the idea of inequality and COVID. And I think there's kind of three areas of inequality that I really want to discuss today. And many of these will be familiar to you, but hopefully we can sort of flesh them out a little bit more. So the first is, how have the costs of the shock of COVID been distributed? How equally have different members of society borne the costs of the pandemic and associated labor market disruptions? The second question we might have about equality and COVID is, how equally have the responses to COVID been distributed? Have people been equally covered by policies aimed at mitigating the shock of COVID? And in third, how do we think about the sort of long shadow of the events of the last year on existing social inequalities? Where are we going to go from here? We can say quite a lot about the first two questions. The last, I think, is speculative. And one thing that I think many of us who are social scientists have learned from previous crises, particularly actually the great financial crisis of 2008, is just how the politics post-crisis can pull in different directions. And so we can speculate, I think, about the coming years, but we may be in for some surprises in terms of how things continue to emerge. So let's start with this first question: how equally have the costs of COVID been distributed? So when we think about the sort of COVID itself as something that's been a major shock to people's health, it's obviously had very unequal effects. So the most obvious is that it's hit the elderly in terms of health risks much more heavily than other parts of the population. But when we look among the elderly, we see, and this will probably be familiar to everyone, but we really see, sorry.
I hate to interrupt you here, but I don't think your presentation is visible at the moment. It just seems to be a black screen.
Let me try again.
And it would be a shame if you,
yeah, I know. How long could I go with, okay, can you see it now?
Yeah, it looks perfect. Thank you.
Okay, thanks for letting me know. Yeah, if anything else happens, let me know. Okay, so everyone is probably familiar with some of these differences among groups in terms of vulnerability to COVID. But I think what they point to is sort of a larger framework that's really crucial to remind ourselves when we're thinking about health and its relationship to income inequality, which is that in many ways what sociologists of health and scholars of public health call a kind of social determinants of health framework, which is that oftentimes when we think about sort of what shapes people's access to sort of health, we think about healthcare. And so in the UK, healthcare is pretty evenly distributed compared to many other countries. The NHS is a fairly equitable system. So there's not a lot of inequality in access to healthcare, although there's some. But there's huge inequalities in actual health. So if you look at infant mortality, if you look at life expectancy, if you look at quality adjusted life expectancies. You see a variation across social groups, across class, and across regions in the UK. And these differences have really come out when we look at the effect of COVID on different populations. And so here's some data from the ONS from the initial shock of COVID. So this is March of last year up to July. And what you see here is the dark green shows deaths. Sorry, this color, I don't really know what it is, kind of greeny black, shows deaths by COVID in the most deprived quintile of local authorities in the United Kingdom. And the sort of paler green shows deaths in the least deprived quintiles of the United Kingdom. And what you can see is that there's not a huge gap in the first month, but as the pandemic sort of picks up in April and May, these gaps between the most and the least deprived areas grow, and they really mimic the gaps that we see in sort of total death rates by all causes in these areas. So there's a huge socioeconomic gradient on sort of which areas have been most adversely affected by deaths in the pandemic itself. And the same goes when we go down to the individual level. So this is by ethnicity, but if we looked at social grade, we'd see something sort of similar. And so up here is white death rates by white British, and the rest is different ethnic groups in the United Kingdom. And these are what's called age standardized death rates. So they try to sort of calculate this per 100,000. And what you can see again is that white British have experienced fewer deaths than many other ethnic minorities, other than Chinese being the only other one that's sort of at the same level. And so what we're seeing when we look at these death rates is that they're mimicking some of sort of the social inequalities that we saw pre-pandemic. And this is not a UK specific phenomena. In the US, there was just a study that came out several days ago on the fall in life expectancy in the last year. And sort of the mean fall in life expectancy has been about 1 year across all groups, but the fall has been sharper among African Americans. And African Americans already, I think, were about 3 years lower life expectancy than whites and Latinos in the United States. And so when we think about kind of what the health shock of COVID has meant for inequality, what we really see is that it's sort of firmed up some of the existing social determinants of health that were already very unequally distributed across the population. Okay, what about the labor market shock? Again, when we're thinking about inequality in the labor market, we have to sort of conceptualize the heterogeneous experiences that individuals have when they sort of move into the initial period of the lockdown and subsequent restrictions on activity. And basically, there's sort of 3 groups of people when we kind of think about this on aggregate. So the first is people that can work in jobs that can transition to work from home. So that's someone like me. So it was sort of stressful to transition to work from home, but basically we just did it and it wasn't a problem. And many jobs look like that. And the kind of people who work in those jobs tend to be, not surprisingly, more educated and older workers. There's a second group of people whose jobs really couldn't occur in a work from home environment. And this includes a number of professionals, like obviously doctors and nurses and teachers, but the vast majority of people in this second group were people who are working in sort of face-to-face occupations that could continue on to some extent. And these tend to be sort of lower paid and younger individuals. A third group are people that couldn't really work from home and whose job really couldn't continue during the pandemic. And these are the sectors that we know that have been absolutely decimated in the last year: aviation, hospitality, and retail. And many in this group moved into unemployment. Some were furloughed. Some have moved back and forth between unemployment, furlough, and employment, but with a lot more income insecurity. So this is probably not the most beautiful chart. It comes from the Resolution Foundation. I hope you can see it, but it's from a survey that the Resolution Foundation, which is a think tank and in London that's does a lot of work on low wage work. And they just produce a really fantastic research if you're interested in the question of the British labor market. But what they've done here is they did a survey, multi-wave survey, I think, looking at people and asking them about their experiences over the last year of unemployment, furloughing, and a loss of 10% or more pay. And what you can see is that if you look at people that worked in like hospitality, entertainment, personal services, and so on, just vast majorities of those, so like we have 70% in the hospitality industry have experienced either unemployment, furlough, or a 10% loss in pay. You can also see, and this is probably the cohort of people that are listening to this talk, that undergraduates in the PPE Society, you're in the 18 to 24-year-old group. So it's probably not any news to you that young people have suffered particularly from what's happened in the labor market. And so young people have lost their jobs disproportionately and taken a hit on pay. Also, probably not a huge surprise that the lowest income have suffered the most. And so people in the first quintile, so that means the bottom 20% of the income distribution, have taken the biggest hit again in terms of furlough, unemployment, and loss of pay. Fewer differences between men and women, fewer differences between whites and Black and ethnic minorities in this, but still this is after controlling for some of these other factors. If you look at these differences without the controls, you can actually see that some of these differences emerge in gender and race as well, but they're working through the contract structure. Now, what about the kind of second group that went back to work but had concerns about their health? I don't have data from the UK, but there's this nice study run by Alex Hartel-Fernandez and colleagues. They're professors at Columbia University in New York. And they did a survey of workers in the United States in the early first COVID wave and looked at concerns about health and sort of how that varied. And what they found is an interesting pattern. So they found that the richest quartile, so that's the top 25%, and the bottom 25% were both most concerned about getting infected at work. They found big differences between non-union members and union members, and among ethnic groups. And so the risks of exposure, again, or at least concerns about exposure, were not equally distributed across groups. So we've talked about the health shock, we've talked about the labor market shock, and in both cases, what we're seeing is that some of the pre-existing inequalities in society were magnified by what happened in the immediate post-COVID era. There's this third shock that we can point to, which is like what happened in the household. So in the first months of COVID, of lockdown, there's this amazing number, which is that 1 billion children were out of school. UNESCO kept this daily, which is the UN's education organization, had this sort of daily counter of where they looked at lockdowns across the world and sort of estimated how many children were out of school. And at its peak, there were 1 billion children out of school globally, and people had to look after those kids. And I'll just show you the map of this. This is from UNESCO, and it breaks down school closures globally by how long they are. I think they've miscoded the UK because I think we're now in the over 31 weeks in the last 52. But you can see that most of the world has had, a substantial number of weeks out of school. And so what does this mean for families? on aggregate, it's meant a huge increase in caregiving responsibilities to parents. And there's a question of sort of how disproportionately that has fallen on women. So the data are actually a little unclear on that. So here's some work by Hupkau and Petrongolo in a very recent article, and this uses UK panel data. So there's a major panel study in the United Kingdom called Understanding Society. It's been running actually in a modified form since the early 1990s. And a panel study means that you follow the same people over time. So you're looking at people over time and sort of looking at what they're doing. And so what they find looking at people and their time use is that, not surprisingly, time spent on childcare among parents of school-age children has gone up really dramatically. So it's gone from 17 to 27 hours for women on average. But we also see that it's gone up for men. So there's been a big jump in men's childcare. But there's still a very substantial caring gap that's happening. And there's some evidence, again, it's a little different across studies and people are finding different things, that women are disproportionately dropping out of the labor market and potentially also losing access to work. And so, again, we see this pattern where COVID is magnifying existing inequalities. So it's magnifying the racial and ethnic inequalities, it's magnifying some of the income inequalities, it's magnifying some gender inequalities. Okay, so that was the sort of first tranche of thinking about inequality. Like, what is COVID doing to inequality? Well, not surprisingly, it's kind of replicating the inequalities that we already see in society. So what about the response to COVID? What about the way governments have actually addressed the pandemic? So what we see there is that pretty much everyone does something, and actually it happens really quickly. So if you've watched US politics at all, I was actually really surprised by the magnitude of the CARES Act in the United States. Now they're in a fight about this again now, and I think it may end up quite this time around. But there was a really rapid extension of pretty dramatic support to the unemployed or the potentially unemployed, and some protection for small business in the United States. In the UK, as you all know, there was the coronavirus retention scheme, which is still in place, which allows employers to furlough workers and provides wage subsidies. Was it also a big expansion of loans and support to small firms. Many countries engaged in eviction moratoriums, so tenants couldn't be evicted during COVID. And all of this constituted a major outlay of state regulatory and spending power across the board. Now, some countries didn't have to do all of this. So if you look at the kind of policy shock of something like CARES in the US or the furlough scheme in the UK, many countries didn't have to do new policies like that because they already had policies. They already had a larger welfare state. And sometimes we describe the existing welfare state in terms of an automatic stabilizer, meaning that when you have a sort of a shock or a downswing in the business cycle, that you have a number of mechanisms that kick in that are meant to stabilize the economy absent these new kinds of policies. And so if you look at the Nordic countries or Germany or France, there's more extensive existing social programs around unemployment insurance, which meant that although those countries did have to engage in new program spending, they already had existing programs that could be extended outward that didn't require the sort of like CARES Act style expansion occurring on the fly. Okay, so what has that meant? So this is another study by Abby Adams-Prassl, who some of you might know. She's a professor here at the university in the economics department. And her colleagues did a number of studies quite early in the pandemic, and they've repeated these at several points subsequently, where they surveyed respondents in 3 countries about the probability of their subjective probabilities of job loss. And so what these data show is there are these kind of indicators that are drawn, the American economists have come up with them that describe sort of by your occupation, how much you can move to work from home. So if your occupation is like, for instance, a janitor, it's very difficult for you to do that job from home. Whereas if your occupation is like a college professor like me, quite easy to transition to work from home. So they divide these into work from home quintiles, ranging from the hardest to work from home to the easiest to work from home. And what's really interesting about this, there's sort of 2 things that I want to flag from this graph for us to discuss more in a moment, which is first, you can see just the magnitude of job losses is a lot, or subjective concerns about job losses is just much higher in the US and the UK than Germany. And second, the gradient on this work from home quintile is steeper in the US and the UK than Germany. So what explains that? So it's partly that the US and the UK had worse first waves than Germany, but that's definitely not the whole story. It partly has to do with the institutions in these countries. And so when we think about the way the existing institutions operated, they shaped in part how vulnerable different kinds of workers were to an income shock. So what happens to unemployed workers in the United Kingdom? So in normal times, when someone becomes unemployed, they can apply for some kinds of income assistance. And that nowadays largely happens through universal credit. Now, historically, the unemployment benefit system in the UK, if you go way back to the 1970s, it wasn't that different than sort of the median unemployment benefit system in Europe. But through the 1980s and 1990s, unemployment benefits are really dramatically cut in the United Kingdom. And they're cut in 2 ways. So there's a cutting of the basic level of benefits that people could receive. And secondly, in many countries, there's what's called an income-related component to unemployment insurance benefits, which means that if you earn more, you get a percentage of your wage when you become unemployed rather than a flat rate. And what happens through the 1980s and 1990s is the income-related component of unemployment insurance is essentially kind of eliminated. And so you end up with a pretty ungenerous flat rate program by the end of the 1990s. When the Labor government comes in 1997 under Tony Blair, they do a lot to expand income security for certain vulnerable populations in the United Kingdom. And there's some sort of walking back of the previous cuts, but these don't actually really affect unemployment benefits that much. They really target a lot of their anti-poverty work and income security work at families. And so what that means is that by the sort of 2010s, the unemployment benefit system in the UK is pretty ungenerous by international standards for working age childless adults, whereas there's a sort of more robust safety net for families with children and so on. Through the 2010s, all these benefits are kind of packaged together with universal credit. And so this makes things slightly less generous for families, and it leaves benefits pretty ungenerous for working age childless adults. And what universal credit really pushes is a much more conditional form of welfare benefit. So when you're on universal credit, there's a number of mechanisms put in place to ensure people are looking for work unless they're really not able to. So when the COVID shock comes, it kind of meets this benefit system that really wasn't constructed for COVID, because The benefit system is looking to push working age people into work. I mean, that's what it's meant to do. And it's really not built for young, working age childless adults. And yet those are the first group that really faces a lot of income shock in the COVID wave, because those are the people that are working in hospitality and retail. There's also not really very generous benefits for people on sick leave, which is another problem during COVID when actually there's a desire for people to stay at home. So this is another figure from the Resolution Foundation. And what it just shows is what's happening with unemployment related benefits over time. So it's a really long time period. This is 1948 down here. This is 2021 up here. And what you just see is this sort of decline of unemployment insurance benefits over this time, especially for working age childless adults. So that's what this figure is showing. So, but this is the group, as I just said, that really is initially vulnerable. So if we look back, and this is another figure from the Resolution Foundation, this is the group that starts to really pick up demanding universal credit in the post-COVID era. So this is August 2019 to August 2020, and these are caseloads. And what you can see is that the caseload of single people without children applying for universal credit just skyrockets. It goes up by 1 million people in the last year. So this is really a group that's very vulnerable. They're not dealt with very well by the existing welfare system. And so this creates a kind of a gap in coverage in the UK welfare state. Now, when we think back to that chart, let me just go back to that. So we have initially like what's going to happen to this group. And so I've just told you the benefit system wasn't really constructed for a lot of these people. But we also have this other puzzle from this, which is like, why are the Germans not, why are they so relaxed about losing their jobs compared to the Americans and the Brits? And one of the reasons for that is there's just a much more liberal system of employment protection in the UK. It's much easier for employers to fire people. And really, that's the way the labor market works. And there's good things about that because it can allow a lot more flexibility in the labor market. But when you get a shock like this, what it means is that employers who are facing immediate income shock themselves are going to pass it on in part to their workforce by laying some of them off in the face of the shock. Whereas in a country like Germany, there's much stronger employment protection, and you have institutionalized systems that allow for employees to go down to part-time positions with some kind of wage supplements paid by the state in order to sort of ease the burden on employers. And nothing like that at the initial time of COVID really existed in the UK. So the result was that the government had to kind of invent policies on the fly. And what we see, and I've already discussed this, is the expansion of the furlough, which essentially institutionalizes something not quite like the German short-time working scheme, but something that does something very similar, which is that it allows employers and the state or the taxpayers to share some of the costs of economic dislocation without firing the worker or laying off the worker. And this keeps people in the labor market. It keeps them with a paycheck so that they're not falling off the cliff financially. But it doesn't mean that the full cost is paid for by the employer. The taxpayer is picking some of that up. And so that shares out some of the dislocation costs across different groups. The government also, on top of that, provided some support for business, and they did expand universal credit. And this is something to really watch in the coming weeks as the new budget comes out, because there's a question of like how far the furlough and how far some of these benefit expansions for universal credit will last. And certainly low-income advocacy groups are asking the chancellor to continue these into the next year, but others are saying they should be pulled back. So this works. It works really well in a lot of ways. It reduces the sharpness of the shock. And if we think about what would have happened to inequality in the absence of these programs, it would have gone up pretty dramatically, because we would have seen those people worried about losing their jobs. They actually would have lost their jobs, and they would have been very exposed to income shocks in the way what we've seen with the sort of inadequacy of the British welfare state for that particular client group. But it does leave some people out. So this is actually something, you guys are the first people to see it. It's a survey that Ben Ansel and I fielded, and we did a two-wave survey. This first wave in September, and the second wave just in a couple weeks ago. And we released it. We had a press release yesterday for a component of the survey looking at vaccines. But I wanted to show you another part of the survey that doesn't have to do with vaccines. So in the first wave, when people were asked about the probability of losing their job, what's interesting is that actually social grade, so social grade is this kind of British concept of class, and A means sort of richer and E means poorer. What you can see is there's sort of a upward relationship here, that the social grade E are more concerned about losing their job than say social grade E, but it's not completely linear, because the highest social grade is also relatively concerned about losing their job. But no one is that worried. So if you go back to Adams-Prassl survey in March, when we surveyed our respondents in August, we're not getting any groups that are sort of up here. And this is because the furlough has, at least among those that continue to be employed, sort of taken the concerns down a notch. And when we look at our second wave, and this is our February wave, we really don't see a socioeconomic gradient. So these policies were fairly successful at neutralizing some of these concerns about inequality, the inequality producing aspects of this. Same with likelihood to face trouble. So this is our first wave of the survey, and we see an upward slope on the social grade. So not surprisingly, poorer individuals are more concerned about paying their bills than richer individuals. But we see a weakening of this divide in the more recent wave of the survey. And just to be clear, these are the same people. So we re-interviewed the same people. So again, the policies have functioned to sort of take down the income inequality, sorry, the precarity concerns that certain people might have. Same with the likelihood of working fewer hours. Low-income people very worried about getting their hours cut in the first wave. High-income people are actually kind of worried about that too. By the second wave, we see a diminution of these the income gradient on these concerns. And we also see less concern about prioritizing the economy in the second wave, except among this one group, than in the first wave. So what this is basically telling us is that a lot of the sort of emergency policies, combined with some improvement in the economy, actually have sort of addressed some of these initial inequality concerns that were emerging in like April and May of last year. But I think the thing to highlight there is that there's still real gaps in the safety net. So there are certain groups that have really been left out, and the self-employed are probably the biggest and most important. So like gig workers, freelancers, they've really been suffering over the last year because a lot of the protections put in place haven't covered them. There's also immigrants are another group because they don't have access to a lot of state benefits. And so they've been very vulnerable. But many other groups have been sort of effectively caught by the combination of the existing safety net with these extra programs. But I think the key thing is that many of these expansionary policies are set to expire. So we don't really know what's going to happen in the coming months when the new budget comes out in terms of sort of how far these are going to go. Now, I recognize I'm almost out of time, so I had a few more slides, which is kind of like, okay, let's come back to the big picture. I'm going to just talk about this for 2 or 3 minutes, and I'll stop. So I think there's a few things that you might want to think about and that I'm thinking about but as I said at the very beginning, none of us entirely know how this is going to play out. But the pinch points that we're seeing right now, the first is intergenerational inequality. So young people are facing a very uncertain labor market. We know from other studies that there can be long-run scarring effects of coming of age during an economic crisis. So I don't mean to say that to scare you, because you are the young people who are coming of age during an economic crisis. you will probably be fine. But for some lower, like young people that maybe have a more tenuous connection to the labor market, there could be these really long run scarring effects. And so when people have looked at really dramatic economic crises, like the fallout of the Finnish economy in 1991, with the collapse of communism, it completely tanked the Finnish economy in 1991. And there was a very deep economic crisis. And that cohort of young people who are now, in their 50s, have experienced sort of lifelong effects of coming of age during the crisis. And when we think about Britain, we have this COVID hit, and we have a really unequal housing market. And these two things are, I think, going to push together in particular ways that could really expand some of the intergenerational tensions. A second area of inequality to watch out for when we're thinking forward is technological change. So the kind of like 2019 way of thinking about technological change is like, okay, we're going to have all these robots. They're going to computerize. They've been computerizing jobs for the last 30 years. That's going to accelerate. And all these mid-skilled jobs are going to go. And maybe that's going to also hit jobs like truck drivers as we get self-driving cars and so on. But that's the group that's, factory workers, clerks, paralegals, those kinds of people are going to lose their jobs. But the technology adoption in the kind of COVID era has been quite quick. And this is combined with this massive job destruction among low-skilled work in hospitality and retail. That now the thinking is that the effect of some of these technological disruptions could go well down the skill spectrum. So we might see both low and mid-skilled work really hit very hard. And there was just a sort of new McKinsey global report that came out a few weeks ago that made this argument about sort of the mass destruction of a number of jobs. And I think this is something that everyone is sort of worried about. And here's a picture from McKinsey Global, which is looking at the COVID crisis and the acceleration of the digitization of customer interactions. And what you can see is that there's just been a mass acceleration of the adoption of technology in a number of areas that involve interactions with customers. So if you think about all sorts of things like sales, retail, and so on, the question is whether any of the, to what extent a lot of these jobs are going to come back when we open up again. Income inequality. So pandemics actually have mixed effects on income inequality. So like early Spanish flu, those kinds of things, they killed a lot of working age people. And that actually tightened the labor market a bit and pushed up wages. And that sounds like a really horrible way of saying it, but sometimes that does happen. Other pandemics have actually exacerbated income inequality. And I think we're in that kind of a pandemic, the latter kind, where we're seeing some of the reactions, particularly in monetary policy, that have been sort of trying to goose the stock market and property markets, that could, in the long run, really exacerbate top-end inequality. We don't know, but that's the way things are looking right now. And this is also going to be particularly hard because it's going to hit small firms, small business and retail and so on are much more vulnerable than large firms. So we could be seeing a sort of a rise of sort of income inequality, not just through the precarity of low skilled people, but also through the sort of relative benefits that are going to tech and the high skilled and owners of capital that are invested in high skilled or in tech firms and other sectors versus small to medium sized enterprises. And then we just have all these other uncertainties, like what's going to happen with educational inequality? What about gender? So if you have, lots of moms that are dropping out of the labor force, what's going to happen when things pick back up? You can have a long shadow of crises. That's what we saw after the financial crisis in the US, where we see a flatlining of female labor force participation. Young people out of school. I work on education. The group I'm really worried about is these 16 to 18-year-olds that were already at risk of low performance, that haven't been in school for the last year extensively. Very concerned that they won't have smooth school to work transitions or opportunities for further education. And that could, again, have these long run scarring effects. We don't know what's going to happen with cities versus rural areas. So the last years have been very kind to cities. Cities have been growth hubs, but we've now seen a sort of deconcentration post-COVID. That could be an area that really we see some rebalancing. So the concluding thought, I think, is that when we look at COVID and the responses, what we see is that they're really reaffirming existing inequalities. But when we're thinking forward, there's a lot of uncertainty, and the politics of that could play out in a variety of ways. And so I think, we may see that voters push for more social safety net and sort of push policies towards more generous, but we may not. And I think this is an open question. So sorry for going over on time, but I will stop here.
That's absolutely no problem. Thank you so much, Jane, for your great presentation. I mean, you gave a great overview of the topic and also a great line of argument to show how all the different areas and sectors of society have been quite strongly adversely affected by COVID-19 and also the measures which have been taken to combat it. And one of my first questions concerns a really recent development, which is the ruling by the UK Supreme Court to declare Uber drivers workers. Because during the COVID pandemic, a lot of people who have lost their jobs, especially people in low-skilled sectors, have been re-employed in the gig economy. That has been through when we order meals through Deliveroo, or when we order a car through Uber, or whatever. What do you think will happen now that the relation between employer and employee has changed there and will probably also change in other fields? And in general, what do you think has been the role of this kind of change in the labor market when we try to understand inequalities caused by COVID?
Yeah, great question. So I don't have a really good question to the first part. I think my colleague, Magdalen Jeremias, Adams-Prassl, is probably one of the biggest experts on this question, not just at Oxford, but even globally. And so he would be the person that can sort of give you a sense of what this means in terms of the actual shift in employment law. But I think what you see, I think you're right to say, like, okay, so there's sort of the gig economy is kind of a double-edged sword. So on the one hand, it has been a shock absorber for a lot of people. So under conditions of uncertainty, people have been able to use gig economy work to supplement their household income. And actually, we know that when people feel uncertain at work, so in households, both husbands, wives, or partners can often sort of pick up work using freelance. And this really is a shock absorber within the household, and it has acted in many ways in that regards during the COVID pandemic. On the other hand, though, when people are living fully on fully on work from the gig economy, they lack protections, legal protections on a whole number of risks. So like health and safety, pregnancy, et cetera. And they lack access to many of the sort of still employment related benefits. And so one of the questions in the last years has been like, okay, so what do we do about gig workers? Do we invent new benefits that are sort of take try to work with some of the benefits of the flexibility that offers? And there were some ideas in the US, some economists have floated ideas about like independent contractor benefits. And there was a debate in this country about like, do we just extend workers' benefits to the self-employed, but then they have to pay more taxes? So how do we do that? Or should we sort of hang on to the existing architecture of what we have that's both legal and in terms of benefits, and try and sort of bring the gig workers back in? And we can see across Europe, there's really different ways of doing that. So if you get an Uber in Stockholm, your driver has many of the same benefits that other workers would have. And then you have the case like the UK beforehand, or the US, where they're sort of outside of the benefit system. So I think on the whole, this is going to give more protections to that sector of the economy. And that's probably a good thing going forward in terms of thinking about especially as more people depend on that kind of work, that it will bring them back into the social safety net and give them more protections. What it means for employment in those sectors in the long run, I don't know. The other thing, though, just as an anecdote, it is absolutely true. If you I'm in Oxford still, and if you walk down Cord Market in the middle of the day, it's just phenomenal how it's sort of lined with gig workers. And one of the things that I think politically that will be sort of delivery drivers, politically that will be interesting after the pandemic is sort of how people make sense of that, because there is this idea that there's sort of two experiences of the lockdown. There's people who are actually locked down, and then there's a bunch of working class people who are bringing those people things. And what that means when we sort of move out of that in terms of the politics of income redistribution and in terms of the politics of employment rights, I think will be a very interesting question.
Thank you very much. Then my next question concerns, as you just mentioned, the new budget in the United Kingdom and also the longevity of some of the policies we have seen, because I think some of the past developments have shown that once you have implemented a certain policy, it can be quite hard to get rid of it. So just as a broad prediction, in this case for the UK, but also for the United States, can we see a more institutionalized form of the welfare policies? And might this also be based on generational issues, like in this case, redistribution from old to young, or from single and childless to people with children and in a relationship?
Yeah, I think this is really the open question. So I think there is this view that we're at a kind of critical juncture, and that if we, there's critics of spending are sort of saying, like, if we don't claw back now, then yeah, this is going to be institutionalized. It's going to be harder to do later. And so I think the next 6 to 8 months will be interesting to watch how that plays out. And so I think I'm not sure I'm not sure things will be as set in stone as they appear. So it's going to be very difficult in the coming months to really claw things back entirely. If we go into the summer and there's sort of a boom, a post-COVID boom, then the question is sort of where some of these policies go. And I think there's sort of two countervailing things to look at here, which are sort of to think strategically about what different actors politically kind of gain, like what would be sort of the political gains to sort of pursuing austerity in the current moment. So I think there's a core group of advocates, both in the US and the UK, pushing along those lines. But the political climate around that is very different than it was in 2010. So the strategic incentives to sort of follow that, as well as the economic ones, I think are quite different. And how things play out in the coming months will probably shape whether there's sort of a more supportive constituency for pushing forward on some of this. And so I think it's an open question. I guess I think it's an open question, and I think it's maybe more of an open question in the US too, because I think the post-Trump Republican Party is sort of figuring out how to position itself on some of these things. And what we'll see, we're seeing some echoes of what we saw post financial crisis in terms of the kind of brinksmanship they're playing on this, but I think they're kind of finding their feet in terms of like how far they want to push on some of that.
Thank you very much. My next question would then concern educational attainment. As you just said, there have been gaps in educational attainment, especially for people who were already disadvantaged to begin with. But I'm also more interested into diving a bit into the class divide we see in the United Kingdom. And I wanted to ask you whether class-based differences are not just exacerbated, but whether this could perhaps, because those differences are exacerbated, whether this could leave the class cleavage in the UK a bit reignited and perhaps a bit more salient at coming elections.
Yeah, that's an interesting question. So I think the question is sort of on that side is sort of how, so there's some really nice work actually by our colleagues here, Jeff Evans and James Tilley, which you may have read in political sociology, that sort of makes the argument that, look, the class divide's always been there. What differs is how it's been politicized over time. And, as the Labour Party moved to the center rhetorically under Tony Blair, the class divide didn't express itself as a voting divide. So I think the question about sort of can or will the Labour Party sort of figure out a way to kind of remobilize aspects of the quite class-based experience of COVID into an electoral campaign, I'm not sure about, but they might. One thing we do know from looking at the data, though, is the Conservatives are really popular right now. So people are pretty happy. Johnson has high levels of approval. I mean, a lot of this comes from high levels of approval over the vaccine. So I think it could fall apart if once the sort of enthusiasm about the vaccine wanes a little bit, and if some of these economic issues become more salient, it could fall apart. But right now, Labor is in a tricky position in terms of how they position themselves. And one of the things that, of course, the party is interested in doing is sort of recapturing a lot of the voters that they've lost in the last years, and sort of how they can do that without losing some of their urban voting base has been, I think, a sort of perennial challenge. Now, how might education play into this? So I think education could come in a couple ways. So basically, education, the lockdown has been bad for educational inequality, and we know that that because low-income kids, they have parents that are just more likely to be working outside of the home, so the parents can't sit with the children by the computer, and the kids might not have access to computers, and they might be in a crowded place where they're not able to get the lessons. And so there's a lot of things that are working against that. That one countervailing thing might be, though, that more people, if the labor market recovers slowly, particularly in the kind of lower skilled jobs that young people or teenagers might go into, if that recovers slowly, more young people may have an incentive to stay in education. That's my one sort of silver lining hope out of this, is that some young people that might have otherwise gone into the labor market, maybe they won't see it as attractive. They decide to do some further education. And so that could be a good thing in the long run. But I think that experience and how it's politicized, and we'll see if there are politicians that are able to speak to young people effectively and sort of mobilize on this experience that they've had in a way that gets them into politics. That will be very interesting to see.
Thank you. I mean, as you just said, the educational attainment is definitely always an interesting choice during a financial crisis. Although I don't think the flexibility of the UK system might allow for that. But
yeah, no, that's a good point.
Then my next question is also concerning your recent work, and perhaps a bit less PPE-ist than you might expect, but it concerns vaccine distribution.
Okay.
Because as you have seen in the United States, there has been a strong ethnic gap between ethnic groups when it came to vaccine rollouts, and you could also argue that this is probably also along income lines. So my question would be, once we start slowly reopening and people get vaccinated, people return to work, people return to their social life, besides the gap we will see in vaccination, what other inequalities might be exacerbated by this? So by this initial gap we're seeing, and also what kind of policy measures would you suggest to governments who want to have some sort of egalitarian vaccination policy?
Yeah, so I think this is where the UK and the US look really different. I mean, I think that the UK's vaccination policy has been fair, objectively fair. I mean, fairness is always a subject. Like, what does fairness mean? There's lots of different ways we can think about, like, who has priorities on a scarce resource. But the process that's been followed here has been perceived by the public to be fair, and probably in the long run will be fair, in the sense of like distributing not just to the people who are most able to get access. And what that's actually, I think, done in the UK is it's both been a boon for the government in terms of people associating what they see as a relatively smooth rollout of the vaccine with government competence. So that's been a positive for the government in terms of building trust. But it's also been the case that it's meant that the process itself is viewed as fairly legitimate by the British public. So in our vaccine survey, we find that people, overwhelmingly support the age-related distribution model. It's seen as legitimate. Now, in the United States, and this is very anecdotal, but lots of my friends have been vaccinated in the United States. And essentially, it's much more of a scramble. So there's meant to be sort of priority for key workers and so on. But if you're sort of marginally related to health or education, you can get on the list. And then it's a matter of sort of calling the office or, trying to exert yourself. And we know that, as you said, there's been gaps in income and ethnic distribution, with the people most able to demand a vaccine often being the ones that get it, rather than following sort of a predetermined criteria. So that's a really interesting question that you asked, like, what will that mean for the politics of this as we go forward? And whether this sort of the disadvantages, the communities that are very vulnerable to COVID, perhaps not being able to access the vaccine or not demanding it, partly also because they may have low levels of trust in the state and in the medical system for a variety of reasons. And that would make them even more vulnerable in the long run and may lead into a spiral of continued sort of mistrust. And I think that is a real concern. And it's possible that in the UK that this plays out very differently because of the much sort of fairer system of vaccine distribution. But then I guess the question of, like, what happens then when some people are vaccinated, some aren't, in terms of how, what that might mean for inequality. That's an interesting question. And I don't really have a good answer to that, but I think you're right in your intuition that if some groups are more able to re-enter the labor force, and that those groups are not random, they're sort of the ones that were most able to grab the vaccine early, that this could then be another exacerbating factor in the United States.
Thank you. Being conscious of time, I would then ask you one last question regarding perhaps an outlook into the future after COVID, because so far what we've been talking about have been inequalities, which have been exacerbated, which have been newly created to some extent, and how governments have initially responded to them. But there's also a time after COVID. There's also a time when some of the current schemes are running out. So my question for you would be, what could governments do as long-term economic policy to perhaps enact some changes in their political economy and try to reverse or at least limit some of the inequality which we have seen because of COVID?
Yeah, so this is a question, one of the kind of questions that came up that became quite hot in the last year. It's like, universal basic income. Is now the time? Does COVID tell us now's the time? My own view is I'm skeptical of the universal basic income. But maybe I'm less skeptical than I used to be. I'm still kind of thinking that through. I think what there's a couple lessons that are worth pondering. The first is that and this is a point that my colleague, co-author Julie Lynch, has made pretty forcefully in a number of places, which is that we need to sort of accept socially what she calls a degree of slack in the system. So, like, having some redundancy built into a system. So often we think efficiency is the best thing. Like, we would like the most efficient state, but when a crisis comes, what you find is that actually having a little bit of slack in the system, a little bit of redundancy, can actually make things work better. And that's one of the reasons that systems like the German or the Scandinavian ones have been, to a degree, better able to weather crises without these massive forms of economic dislocation, because they have systems in place that allow for some sharing of the burdens, and they're built to withstand a degree of there's a bit of redundancy built into the system that allows. And I think that that's probably a good thing in general, so that there's some sort of longevity to these systems. Then whether you believe in universal basic income or not, and this is actually almost more of a kind of a normative point than it is a positive point, I think that we need to rethink income support for low income people. I mean, there's certainly been a debate in the US about child allowances, which has brought Mitt Romney together with people on the left. There's been a debate in this country about what we think about universal credit. And I think both of those are really useful debates to have, because really conditional, really punitive programs that don't support vulnerable low-income people, especially with children, but also without, can have these really negative consequences, both in the labor market and on people's ability to upgrade skills and on people's ability to sort of support children. And COVID's exposed a lot of that. And so in that is another area that I think, whether it goes in a basic income form or whether we think low income support in other ways, that I hope that discussion continues post-COVID.
Thank you very much. With this very good and very interesting answer, I would like to conclude this talk and slightly use this opportunity on the one hand to thank you, Professor Gingrich, for giving us this really interesting, well, more lecture than a talk, but it was very, very interesting to listen to. And also thank you for all the questions you've answered. You provided some great insight into topics which are currently very relevant and will probably also stay relevant for the coming years. So thank you very much for joining us today. And as a last opportunity, I would just like to use this to promote our event next week on Friday, March 5th at 6 p.m., where we'll talk about the history of racism in Western philosophy.
Great.
Thank you very much. And looking forward to see you all soon.
Thanks, Mika, Eric. Thank you for the invitation.